Hi, Amber.
Hi.
I just wanted to give you a little bit of feedback about how the interview went. How
Okay.
did you think it went?
I felt pretty good about it. I was
Mm-hmm.
able to screen her for all the different substance use areas and give her a lot of information, I thought, on the
Yeah.
recommended limits. And I thought we got to a pretty good point at the end.
Uh-huh.
I felt okay.
Yeah, I thought you did a really nice job asking her a lot of the questions. She obviously didn't do a lot of other things besides the drinking.
Right.
And then you got to the drinking, which was really important. And obviously she was drinking at above the limits that we want her to drink at.
Right.
And
Right.
they're recommended anyway in terms of that. So I thought you did a really good job doing that. I thought you asked her some interesting questions. You asked her some open-ended questions, and you got her talking a little bit about her drinking. So I thought that went very well. I also liked that you connected the drinking with some of the things that could happen.
Right.
And there I think you might even be a little more explicit about
Okay.
some of those, about accidents, about other kinds of things. Do you think she really thought that her accident was related at all to the drinking?
I don't know that she was totally on board, that she, I sort of could tell that she wasn't completely convinced, but I thought it was really important that I share the information with her and make sure that at least in that interaction she got it, and maybe she'd think about it later and she'd be able to make some changes.
And exactly, and we've seen enough in this unit here to kind of know that there's a lot of these
Right.
accidents that are really alcohol related. So you're convinced of it, but she wasn't.
Right.
So I do think that's what you really want to do, is try and get her a little more on board. So I might ask her about how much she drank today and whether she thought that might have related to or influenced the fall at all. And just get her thinking about that before you actually say, well, there is a likelihood that contributed. But I think it's helpful to get her. If you don't get them involved, then they don't really buy into the problem.
Okay.
And then the second piece is kind of getting her about the goal.
Right.
So I thought it was good that you gave her the actual kind of guidelines, and you gave the advice based on the NIAAA guidelines, and that's
Right.
really important. When you got to kind of, then is that a goal, I thought you made a leap possibly that you could have negotiated a little bit better with her.
I just didn't feel like there's a lot of time, you know what I mean,
Yes.
to talk about that, so I just want to make sure that I got it in there.
Right, and I think saying the
Yeah.
advice first is really good. I think, again, it might not take you a little bit, it might take a little bit more time, but probably not to just ask her, so what do you think about that, and
Okay.
what do you think about maybe cutting down?
More open-ended.
And leave it a
Yeah.
little more open-ended so she could actually get in there with you and kind of say, well, I don't know, it's going to be hard to cut down, but maybe I could a little bit.
Yeah.
Then you have an entree into kind of
Okay.
setting a goal.
So maybe I should have done some of that first.
Yes, I think a
Okay.
little bit of that first might be there. And then when you get to the goal, I mean, suggesting, she goes, oh, I don't think so, I drink normally and whatever. So even suggesting just to kind of, maybe you could do a little bit less, and maybe one of the nights or the nights that she was drinking the most. So get to more specifics kind of,
Okay.
and she may be able to kind of buy into that and say, oh, well, maybe I could go 5 or 6.
Not so much
student-
change at one time. kind of
Yeah,
thing.
so it get a
Okay.
little gradual. I know you're not going to see her again, so I
Right.
do think that you want to give her the best advice that you can, but you also want to negotiate with her, what can she do? And maybe leave it then with, I think ultimately it would really be good to get down to no more than 3 and no more than
Okay.
7. So
Right.
now you
So I
again,
can get back to that
you can get back to
eventually.
it and give it to her without
Right.
doing that. So what do you
Okay.
think about that?
It feels like I don't have a lot of time and I
Yeah.
don't see these patients very long, and so I'm just really trying to make sure I incorporate the things that I've been learning about, and that I'm getting them the important information.
Right.
So
You have, and I know it's busy and there's a lot of things going on, and you do have to get out of here.
Right.
So I guess I'm not trying to get it longer. We may just want to ask 1 or 2 more questions in there and then reflect back on her
Okay.
responses to kind of get there. Because even the question about why, she got into a long discussion about that, but even, about how could you cut down as opposed to why do you drink? So
Right.
that she gets there. And then when she's questioned you about where these goals came from, said, well, sounds like those goals you seem a little overwhelmed by kind of how the goals, and just have her
So
talk
sort of
about
acknowledge
that.
some of her resistance?
Exactly.
Oh, okay.
So if you acknowledge that a little bit, she might lower the resistance and might even think about
I
cutting
guess I didn't
back.
really want to go there, you know, I wanted to make
Yes.
sure we got to like where she needs to go.
Right, you don't want to have a long discussion, that's for sure, because you don't have the time, and I
Right.
respect that. You just want to have a more focused and possibly a discussion that might engage her a little bit
Okay.
more.
Okay.
So overall, I think you did a really nice job. The brief intervention, like I said, could be better in terms of getting her engaged a little bit more and getting the goal more mutually agreed upon.
Right.
But otherwise, I thought it was a very nice, respectful, good screening, and you gave the important advice that she needed to hear about the kind of standards that are important for her to kind of see and see if she can get there.
Yeah.
So
Okay.
nice work.
Thank you.
You're welcome.